Hi, I'm Theodora Scarrato. I'm Executive Director of Environmental Health Trust. I'm a parent here in Montgomery County, and I am calling on the board to begin the process of supporting safe technology for students during virtual learning. So at our home, my children are connected using an Ethernet cord, and that is something that every student connecting in Montgomery County, and really teachers as well, should have access to. So what I'd like to ask the Board of Education is that they can ensure that students and teachers have access to the hardware and software, internet connections that will allow safe, non-radiating technology. That would be Ethernet cords as well as adapters, so they can plug the Ethernet into their Chromebooks or their laptops or their tablets and have a connection so that the radiation goes through the cord and not through their bodies. Wi-Fi is an environmental pollutant, and there are actually hundreds of scientists who are calling for reductions of wireless radiation to people rather than increasing exposure. You actually get much higher levels of wireless radiation in the air, out of the device into your body when you are streaming video.
Now this is a simulation of the Wi-Fi electrical field in a 6-year-old child facing a tablet. We have the tablet at 150 millimeters from the head, which is a little less than 6 inches. We can also take a closer look at the Wi-Fi field in the brain by using different scales. We use anatomically based models of people. This means that we simulate the absorption of different parts in the body, such as the skull, regions of the brain, the bones, eyes, and dozens of other tissues. These animations are slowed down by about 5 billion times. Most people are not aware that the waves of the Wi-Fi electrical fields oscillated 2 billion times a second through our bodies.
Students and teachers need to be educated on how to hook their devices up with Ethernet connections, how to minimize exposure to cell phone and Wi-Fi radiation, and keep the devices away from their bodies. I hope the board can approach companies which are donating hotspots or other devices and ask them that instead of donating wireless software and hardware, that they start donating safe wired Ethernet. In addition, this issue is really important for teachers and staff who are working all day on devices, educating children. They deserve protections as well. Maybe you think, no, that really can't be. This can't be true because of course it's safe. Surely the federal government would never have allowed such a mistake to occur where we have a toxic exposure that all the school children and all the teachers and staff are being exposed to. That's got to be fringe science, right? Well, look no further than insurance companies. Insurance companies don't want to take the risk. In fact, non-ionizing electromagnetic fields are excluded as standard because insurance companies rank wireless radiation and non-ionizing electromagnetic fields as high risk, comparable to lead and asbestos. And there are numerous white reports on this issue. We have it all on our website at ehtrust.org. But the question is, if insurance companies aren't willing to risk, make a financial risk, then why would parents or all of you who care so much about kids take that risk as well? The California Department of Public Health actually issued guidance on how to reduce exposure to cell phone radiation, and the teachers union is asking that that be disseminated to all students and staff, how to reduce exposure to cell phone radiation. But something that you'll find really interesting is that the California guidance actually was first drafted about a decade ago, and it was for employees of the state to reduce exposure to cell phone radiation. Remember, that was before we were using cell phones a lot at that time. And it was covered up for years and years. It only saw the light of day because of a public information request by Dr. Joel Moskowitz at UC Berkeley. Please look him up and look at the research that he has put together on his website, Safer EMR. So these are unprecedented times, and I hope you will take unprecedented action. Thank you.